Flowing crude drugs does not contain resin. Asafoetida contain oleogum resin. Incorrect about alphabetical classification. Help to suggest substitute of drug. First step of dispensing proprietary product is verification. License validity after constitution change 3 months. Cod liver oil source of vitamin A and D. Cod liver oil is a source of vitamin A and D. Prescription from under DNC Act. Prescription from under Drug and Cosmetic Act is Schedule A. BED stand for Vital Essential Desirable. Not used for anesthetic procedure is stethoscope. Ether is a general anesthetic. Halothane is a general anesthetic. Nitrous oxide is a inhalation anesthetic. Form for restricted cell. Form 20A. Mandatory document for dispensary proprietary medicine is prescription. Which of the following is a third generation of cephalosporin? Cefoperazone is third generation. Cefazolin first generation. Cepaclor second generation. Cephalexin first generation, but cefoperazone third generation. Cefoperazone third generation. Redman syndrome is associated with which drug? Vancomycin cause histamine release. Redman syndrome is associated with vancomycin. Gentamicin cause or syndrome of ototoxic nephrotoxic. Erythromycin gastric upset. Tetracycline teeth discoloration. Amoxicillin different from ampicillin mainly in oral absorption. Hypersensitivity reaction same in blood. Antibacterial sputum almost same. Penicillin is resistance, both not resistance, but oral absorption amoxicillin better absorb. Oral absorption amoxicillin better absorb. Sulfonamide are primary metabolized by acetylation. Sulfonamide are primary metabolized by acetylation. Clotrimazole is combination of sulfametazole plus trimethoprene. Sulfioxazole plus metronidazole. Wrong answer. Sulfadiazine plus pyrimethamine for toxoplasmosis. Sulfotoxin plus pyrimethamine malaria, but sulfamethoxazole plus trimethoprene synergistic. Sequentis block. Penicillin did both acid resistance and penicillin resistance is cloxacillin. Benzyl penicillin is acid labile. Ampicillin acid resistance but not penicillin is resistance. Amoxicillin is the same as ampicillin, but cloxacillin is a acid resistance or penicillin is resistance. Cloxacillin is a acid resistance and penicillin is resistance. Chloramphenicol toxic mainly cause aplastic anemia. Aplastic anemia. Chloramphenicol toxicity mainly cause aplastic anemia. Tetracycline should not be given to children because yellowing of teeth. Antibiotic contraindicated in myasthenia gravis. Gentamicin. Gray baby syndrome caused by chloramphenicol. Chloramphenicol causes gray baby syndrome. Atropine block acetylation, atropine block, acetylation, muscarinic receptor antagonist. Airway obstruction during anaphylaxis is best treated with adrenaline. Airway obstruction during anaphylaxis is the best treated with adrenaline. Salbutamol is a beta 2 agonist. Diphenhydramine is a supportive only hydrocorticoid. Delay effect. Parasympathetic stimulation on areas cause miosis. Pupil contraction. Miosis is a sympathetic. Cyclopegia is a loss of accommodation. But meiosis is a pupil contraction. Meiosis is a pupil contraction. Beta 1 receptor stimulation mainly cause high HR plus contractility. Vasodilation is a beta 2. Bronchodilation is a beta 2. But beta 1 receptor is a HR contractility. Selective beta 1 blocker is a atenolol. Propranolol is a non-selective. Labetalol is a alpha plus beta blocker. Carvedilol is a alpha plus beta blocker. But atenolol is a selective beta 1 blocker. Prodrug condensation product of aspirin plus paracetamol is benzoylate. Phenylephrine is a paracetamol precursor. Product of condensation product of aspirin plus paracetamol is a benzoylate. Product condensation product of aspirin plus paracetamol is a benzoylate. Cimetidine side effect is gynecomastia. Agranulocytosis is a rare with clozapine. Cimetidine side effect is gynecomastia. Cimetidine side effect is gynecomastia. Omeprazole act by inhibiting proton pump. Omeprazole act by inhibiting proton pump. Misoprostol contraindicated in pregnancy. Misoprostol contraindicated in pregnancy. Systematic antacid is a sodium bicarbonate. Magnesium tricyclate is a non-systematic. Calcium carbonate is a non-systematic. But systematic antacid sodium bicarbonate is a observe alkalolysis risks. Steroid acting on estrogen receptor is anabolic steroid. Major function of insulin, blood glucose. Sulfonylurea act by stimulating the insulin release. Drug of choice of hypothyroidism is a T4 levothyroxine. Drug used in thyroid storm is propionuracil. Anti-arrhythmic digoxin level is quinidine. Drug of choice for management hyperthermia is succinylcholine. Digoxin toxicity is increased by hyperkalemia. Nitrosocide act by releasing nitric oxide. A C inhibitor act by inhibiting angiotensin II formation. Benzodiazepine not metabolized due to active metabolite in diazepam. Flumazenil is an antagonist of benzodiazepine. Drug of choice for absence seizure is ituximide. Antipsychotic with highest agnostic risk is clozapine. Parkinsonism is an adverse effect of chlorpromazine, haloperidol, thiouridazine. Pharmacokinetic and biopharmaceutic is 75%. Zero kinase not seen in barbiturate, but seen in salicylate, phenytoin, ethanol. Drug with high fast metabolism is propranolol. Loading dose depend on volume of distribution. Loading dose depend on volume of distribution. False statement regarding fast order kinetic is constant amount of elimination is zero order kinetic. False statement regarding fast order kinetic is a constant amount of element, that is zero order kinetic. It is a zero order kinetic. Renal clearance depend on reabsorption, secretion, GFR. Microsomal enzyme inducer is rifampicin. Glomerular filtrate, blood minus plasma, protein and cell. Fashion metabolites involve oxidation, reduction, hydrolysis. Fashion metabolites involved in oxidation, reduction, hydrolysis. Bioavailability of IV drug is 100%. Uterine relaxation in preterm labor is retarded. Oxytocin is cause contraction. Ergometharin is a contract uterus. Microsomal contract uterus absorption. Oxytocin cause contraction. Vitamin deficiency biosynthesis is vitamin B6. Disulfiramide like reaction seen in all of the above: metronidazole, tinidazole, cephalosporin. Protamine sulfate antidote for heparin. Live attendant vaccine is oral polio vaccine. Rabies is a kill vaccine. Hepatitis B is a recombinant. Tetanus is a toxocyte inactivated.